Morning, my name is Meg Faure. I'm the co-author of Baby Sense, Sleep Sense, Feeding Sense, and Your Sensory Baby. And I'm delighted to be with you weekly on my video blog to chat about questions that come up around your baby. This week we're going to in particular be looking at feeding, those challenges that come up at around 6 months of age when your baby doesn't want to continue eating solids. The way that we're going to do this is I'm going to have a look at a question that came up on our Facebook party this week. And that was from Chantel Harker. And Chantel said, Meg, is it normal for babies not to want to eat their solids? All of a sudden, my little girl doesn't want to eat. She prefers her bottle. She loved butternut, but now won't even open up her mouth. Been going on for a few days, trying to get her to eat, but also don't want it to be unpleasant for her. She's 6 months old now and sprouting 4 teeth weekly, 8 teeth at 6 months. Crazy, poor thing. Chantel, that is a lot of teeth for 6 months. What many moms don't know is that babies' teeth only really start to come out at 6 months and then progressively come out from there to 12 months. So to already have 8 teeth at 6 months, she really has been teething up a storm. I can imagine as well that she's going off her food. That's very, very common with little ones who have been teething. And so I would suggest that you actually help to reduce the pain and the inflammation in her mouth so that it isn't so painful for her to feed. The way that you can do that is to give her a little bit of tea gel or some teething powders, and certainly give her a frozen teething ring, which you can get at any retailer. Freeze it and then give it to her just before the meal so that her gums are nice and numb, so that when she starts eating, she's not in so much pain. Of course, teething also causes a snotty nose, lots of mucus, and sometimes a runny and uncomfortable tummy, and that could also be why. So be patient with her. I love the way that you don't want it to be an unpleasant process for her, because feeding needs to be pleasant. Don't bring feeding wars into it, and if she doesn't want to eat, you may need to go with that flow. Having said that, there are 2 tips that I think that you can follow in order to help your baby with her feeding. The first thing is that babies who are drinking too much milk don't have appetite for solids, and we often see fussy eating in that circumstance. You do mention that you're giving her more milk now that she's being so fussy with the feeding, so I would actually hold back on that milk. At 6 months old, all you want for your baby is 4 milk bottles or milk feeds a day. So that would be 1 on waking, 1 at bedtime, and then 1 mid-morning and 1 mid-afternoon. So if she's having 4 bottles or 4 breastfeeds during the course of the day, she's actually getting all of the milk that she needs. And if that's all the milk she has, she will in fact have an appetite. Try to resist the temptation to give her bottles at night. Maybe at the most only 1, but really hold back on that milk so that we can activate that appetite. What we do know about milk is that it doesn't cover all your baby's nutritional needs from 6 months onwards, so it's important that we get her onto solids nice and quickly. Another wonderful strategy to deal with babies between the ages of 6 months and 8 months is baby-led weaning. Now, baby-led weaning has gained great popularity overseas, and it's something that I do advocate. We talk about it in our book, Feeding Sense, so you can read up more there. But the concept is that from 6 months old, your baby can cope with and deal with absolutely fine whole steamed vegetables and food. So what you want to do is whatever you would have normally turned into a mush, you now steam it well and pop it whole on her plate and let her control it, her actually engage with the food. What often happens is that your baby might the first few times touch the food, explore it with her hands, might even take it to her mouth and spit it out, and you're going to have a lot of mess going on. But within a few feeding sessions, she'll start to get the hang of it and actually start to eat. Don't worry if she gags. Gagging is not choking. Don't react negatively. Just watch her and obviously never leave her while she's eating whole food. But just allow her to engage with the food and to embark on baby-led weaning. I know for many moms you're going to be going, oh, hold on, that's not what I want to be doing because I want to really control what my baby eats. That's a very natural instinct. So there I suggest you have a 2-bowl system. So you have your bowl, which is full of mush, so you can steam the same food, have the scrambled egg, have the chopped up pieces of chicken or whatever it is, and have that on your bowl. And feed that to her yourself from a spoon, and then have her control bowl in front of her with the whole food that's been well steamed that she can control. And over a process of a couple of months, she'll take more and more control and eat more and more out of her bowl, and you'll be able to feed her less and less from your bowl. Enjoy it. Enjoy the feeding, and certainly start with the variety, manage the pain, and allow her to do some baby-led weaning. Good luck, Chantel. That's all, folks. That's what we were speaking about today, was feeding your baby, and I hope that you've been able to pick up a couple of tips if you've got a 6 to 8 month old baby. And we'll see you next week at the same time. Thank you.